Working in the NHS at the moment is difficult, it's stressful and it's challenging. However, the NHS have got bags of pride and we know that we will get through this.
We need you to follow the advice of the government, stay home, social distance, wash your hands and only go out when absolutely necessary. Lots of us, including me, have been separated from our families until this really scary time is over, and the more of you that comply, the sooner people like me can get our families back together again.
My role has been to recruit a workforce of doctors to assist both on the wards and supporting some of the care home work that the Trust is involved with.
I retired from nursing in December 2017 and I've returned to practice to support the Derbyshire response to COVID-19.
When the message came out that the wards needed help, I felt I just couldn't sit at home knowing that I had the skills that they needed. It was scary, I will admit.
I'm currently working as an aspirant nurse for the DCHS and I'm working really hard to support the Trust and the patients during the pandemic.
Our pandemic response unit was crucial in supporting and redeploying our colleagues across the organisation to ensure that essential services were maintained.
There were definitely some challenging moments for us coming into new teams and new settings, and definitely for the staff who had to train us all in such a difficult situation. But on the whole, we really supported each other, and I feel it was a privilege to be in a position to help out during the pandemic, even in a very small way.
On in a ward at Ilkeston, we became the designated COVID ward for DCHS during the pandemic. This caused a lot of anxieties and challenges for the staff, but what a brilliant team.
At times during the pandemic, staffing our 6M patient wards felt like an impossibility, but we somehow managed to get through it, and that was really testament to people's goodwill and flexibility. We received offers from people on annual leave and people from other divisions within the Trust who'd never worked on a ward and were still willing to come and help us out.
During lockdown, none of our patients on the ward were able to have visitors. For the patients with dementia, this was particularly difficult, as sometimes they just needed the reassurance from their families.
I was shielding for 5 months during the pandemic due to a health condition, and the best way I can describe it is feeling quite scared, losing myself and then eventually finding myself again.
Feeling isolated has affected many of us over the last 18 months. With the lockdowns and the feelings that you can't mix in groups. Imagine then if your only connection with people that are like you, that are the same as you, is in Manchester, or your friends in London, or a group that you attend in Derby. It's certainly been very difficult for our LGBT friends and family and patients and service users.
Silver Command coordinated the operational response to the pandemic. A group of representatives from across the organisation came together to make decisions on a daily basis, ensuring that our staff and patient health and wellbeing always remained at the forefront.
Managing IP&C during the pandemic has been extremely difficult, especially in the initial period when guidelines were changing on a regular basis. In these unprecedented times, our main priority has been to keep our staff safe.
Throughout the pandemic, estates have been tasked with various things, whether it's been converting old disused wards to COVID treatment centres, to setting up and supporting the COVID vaccination programme. It's been stressful at times, but it's made me very proud to be part of the estates team and the NHS as a whole.